There's no basement here? Okay. that's
Very
sweet.
good. All right, we're just getting set here. So the
Okay.
focus of today's discussion will be Black Swan. All right, we're live. So focus of our clinical attention is Aronofsky's Black Swan. Any particular scene, character, any place the group would like to start. There's no wrong answer.
I think at the beginning, there was like right after like the first like rehearsal or like audition, there was the scene where she went to like the bathroom and she was like it was like foot down, it was covered. So it's kind of insinuating some kind of like body dysmorphia or some kind of disorder. That's where it starts.
Bathroom stall.
Right.
Okay. And scene prior, what happened?
If I remember correctly, it was like she was in a high stress situation. She was like doing the rehearsal or the audition. I think it was the audition right before for like the casting of the Swan Lake production.
Mhm.
So it was high stress. I think she wasn't tapped to be a part of continue on with the rehearsal. So it was maybe like a feeling of worthlessness kind of stemming from that. So felt the need to like purge or whatever she was doing.
Right. And what you identified in psychiatry, psychology is often referred to as a precipitant. So we are observing behavior in that bathroom stall, and clearly something happened in the scene prior that may have precipitated the behavior that we observed. Anything else about the behavior? Did you notice which way her feet were pointing?
It was towards the toilet.
Yeah.
Mm-hmm.
So why would a woman stand in a urinal or a stall with her feet toward the toilet? So I think there's more than enough evidence to suggest that she was purging, right? So now, purging behavior in a vacuum can be normal. However, in the context of other signs and symptoms, observations might be the contrary. And given the scene prior, there is evidence to suggest that this is a stress reaction, and in and of itself might be part of a larger disorder. And that begins our differential diagnosis to maladaptive purging behavior. Now, for examination purposes, purging behavior does not allow for differentiation among the eating disorders. So the three most common types, anorexia nervosa, bulimia nervosa, and binge eating disorder, can all have binge eating and purging behavior. So unfortunately, our discovery of this, while it might focus this group on a particular chapter of the DSM, that is the eating and feeding disorders, does not necessarily allow for that proverbial single best answer just yet, right? So before we move on and now gain more information that will allow us to maybe focus on a particular eating disorder within the chapter, anything else about this scene that you'd like to discuss or comment on? What happens when, first of all, what happens in the stall? I think you may have mentioned it. Anyone? Doesn't she call her mother?
Yes.
Okay. How old is she?
28.
I think
She's younger than that, yeah.
20, like young
Okay.
young to mid 20s. Yeah.
So that's an observation. She called her mother. Now, again, calling mom is, I don't want to say never a bad thing, but in this case might be maladaptive. It's certainly something we need to investigate. And then when she opens the stall door, do we recall what happens next? Isn't there something written on the mirror?
Oh, yeah.
What's written on the mirror?
I think that was a little later.
Was it?
Yeah.
So.
I think that's when she gets the part.
Yeah, same stall though.
Yeah.
Okay, all right. So a
same
little,
thing.
maybe some foreshadowing there. All right, so out of the stall, what are some other observations here? And at this point, we probably should continue our focus on Nina.
kind of building on like the eating disorder, like part of her condition. Maybe like the part, or I remember the scene with like the cake and how she didn't want to eat like that big of a slice, even though it was like a small corner of the cake. She kind of freaked out and lashed out at her mother based on just like that little piece.
Mhm. All right. So, thoughts?
I mean, for me, when I watched that scene, the eating disorder thing definitely came to my mind. But what really stuck out about that scene was not really actually just Nina herself, but her mother's reaction to Nina's tendencies, where the mother's like, okay, then I'm just throwing the whole thing in the garbage. And I think that kind of relationship between with her mother, it could also be like one of the causative factors that kind of it definitely certainly complicates the whole anorexia or bulimia eating disorder condition that she already has.
Yeah. So now you're focusing more on predisposing factors to what may have been precipitated or precipitating that behavior that we observed in the stall. Right now, even though this scene may have come later, the fact is that this ongoing interpersonal relationship really does predate all of the above. I mean, Nina's been enduring this, whatever this is, for her life, right? And yes, you saw a very abrupt reaction from her mom with the slightest bit of what would be perceived rejection have or demonstrate rejection sensitivity. Okay, fine, and right in the garbage, right? So that was her idea. We can get around to mom's behavior, but now I still want to focus on our attention on mom's behavior as it relates to Nina, and now begin to hopefully develop some empathy about what Nina has been enduring for years and continues to endure in this family dynamic. I think at the very surface, at the very least, most of us have observed what is often referred to as restricting behavior, right? So now this kind of sheds a little bit of light on maybe anorexia nervosa. In anorexia nervosa, there are two subtypes. One happens to be binge eating and purging, previously discussed, and the other happens to be restricting, where individuals may demonstrate behavior observed in the cake scene. If an individual demonstrates both, binge eating and purging subtype takes precedent. That is the default. That actually is more important, even though it might be both. Let's talk a little bit about the subtypes. Individuals, unlike Nina, who appears to have both, who only demonstrate binge eating and purging behavior, may have other characteristics that are usually comorbid. Anybody have any guesses as to some comorbidities of anorexia nervosa, binge eating and purging subtype?
Substance use disorder?
Yeah. So impulsivity in general, and of course, substance use disorder is an easy example, and yes, is a significant comorbidity. Is there any evidence of that in this movie? Yeah, I mean, I think there's certainly an ecstasy scene in terms of her interaction with the other ballerina, but it certainly requires further inquiry. But on the surface, at least, it looks as if there's no pre-existing condition. This looks to be her experimenting and maybe even experimenting for the first time, but it certainly requires a little bit more in-depth Q&A from the psychiatric evaluation. What other characteristics are often comorbid with the binge eating and purging subtype?
Depression.
Depression, yeah.
Anxiety.
Anxiety, yes. Anxiety more so with the other subtype.
Okay.
The other biggie to consider is the cluster B personality disorders. Right. So binge eating B, cluster B, right? Which of course also hallmark impulsivity. So what are the cluster B personality disorders? The personality disorders are listed in the DSM 10 plus or minus. One, which was previously categorized as cluster A, schizotypal personality disorder, has been reclassified in the schizophrenia spectrum and related disorders chapter of the DSM. Three clusters, three groups. Nonetheless, cluster B, categorizing four conditions. What are they? What personality, and I'll just re-ask the same question, slightly different way. What four personality disorders are usually hallmarked by impulsivity? Guess. There's no points up for guessing here.
Like addiction.
No, addiction wouldn't be a personality disorder. Not yet, anyway.
Bipolar?
No. One is called borderline personality disorder, antisocial personality disorder, narcissistic personality disorder, and histrionic personality disorder. Those are your four cluster B personality disorders. Clustering meaning that they actually tend to have overlapping signs and symptoms that are shared, and therefore, in a clinical sense, from a clinical perspective, could lend to some difficulty with diagnosis. All right. Binge eating and restricting. The other subtype is the restricting subtype. In restricting subtype, you have more anxiety spectrum, including cluster C personality disorders. So we think of mood dysphoria, more comorbid with the cluster B. You had said depression. You said anxiety. That's consistent with the cluster C personalities, all of which are of high comorbidity with the restricting subtype. The cluster C personalities include the obsessive compulsive personality disorder, avoidant personality disorder, and dependent personality disorder. Right. So just a very brief primer on the subtypes of anorexia nervosa. All right. Any other observations here? Cake scene and then anything beyond. Hallucinations. What did you see to think that there was perceptual disturbances?
So I remember there's a scene she tried to peel her spur off the finger, and she was bleeding, but the next scene was the finger is intact actually.
Okay.
And the other is when she was taking a bath and she suddenly saw some blood, and then the next scene is just there's no blood in water.
Okay. For perceptual disturbances, differentiate for me an illusion from hallucination, more specifically a visual hallucination. So visual hallucinations are perceptual disturbances that are not cued by anything in one's immediate environment, while illusions are perceptual disturbances that are a misidentification of something in the individual's immediate environment. So would we categorize Nina's perceptual disturbances in both these scenes as an illusion or visual hallucination?
I think hallucination.
Hallucinations? So you don't think there was anything that cued?
No.
Okay. Again, I didn't see anything either. We might be both wrong, but
Just illusion, because like I remember she was scratching her back when she see blood in the water, so maybe she just felt that pain by scratching, and that triggers her having these visual things.
so we're in a gray area then. So yeah, maybe indirectly, which again is a great teaching point because individuals' behavior, their experiences do not necessarily fit with these artificial categories that we create, these definitions that we create. And that certainly might be in play here. And that's something we always have to keep in the back of our minds, that we actually create these categories for diagnostic validity as a way for physicians to communicate with one another, especially over time. You mentioned a particular diagnostic label, and that should conjure up a series or a number of criteria in another individual's mind, perhaps somebody who's reading the chart 1 week, 1 year later. But beyond that, sometimes human behavior doesn't fit into these categories all that neatly. And those types of behaviors can certainly be captured in film, reminding us of the artificial nature of, in this case, the DSM. Other scenes here. So we have her hallucinating, we have her binge eating and purging, we have her restricting, we have her using drugs for whatever that's worth.
Also stealing.
Stealing.
she's stealing something like lipsticks
Mhm.
from Bath.
Mhm.
So I think that may be related to the like delusional disease, the jealous type.
Okay. So for delusional disorder, there are 5 subtypes, jealous subtype being one. What are the other subtypes? The
Um,
acronym is JPEGs, JPEGS.
oh,
Grandiose.
Yeah, grandiose, good.
erotomanic,
Good, erotomanic,
persecutory,
Mhm.
somatic.
and somatic, good. Perfect. So we have some jealousy and envy, which might be in the context of a delusion and therefore might be indicative of delusional disorder. More specifically, as you mentioned, delusional disorder, jealous subtype. Um, One of the concerns here is that if she actually rules in for delusional disorder, if we were able to meet with Nina and if we were to allow her to express her frame of mind at or around the time of being in that dressing room and stealing that lipstick, if it is true that she had a thought that was not reality based and therefore likely suffering a delusion, in addition to the perceptual disturbances, this is not likely delusional disorder. That is, the delusion might be in the context of yet another larger disorder, and that would put us in the psychotic disorders chapter, more specifically the schizophrenia spectrum and other psychotic disorders chapter of the DSM. So something to consider. Right? Might Black Swan be a first break episode of an individual with schizophrenia? Right? Just a diagnostic inquiry. Other observations. So we have delusions, we have perceptual disturbances, binge eating, purging, restricting behavior.
I mean, just kind of piggybacking off of like the jealousy, like the paranoia kind of thing. There's a point I remember near the end where Lily, the other ballerina, is selected as her backup, her alternate, and then she says, "Oh, anybody can be the back alternate except for her. She's like, she wants my role. She wants to steal my position." And I think that kind of paranoia also feeds into that idea of some kind of more serious underlying.
Yeah. So if these feelings, these thoughts are not reality based, now she's demonstrating persecutory delusions as well, meaning that if, and I don't think this is true, but hypothetically, if this were to be delusional disorder, so if we were to rewrite, if Aronofsky and us got together in a little bit of a think tank and had some fun with this, and we kind of edited the director's cut type of version and edited out those perceptual disturbances to make this a cleaner delusional disorder, it would be delusional disorder mixed type, where an individual has more than one of the themes that are prevalent during the current episode. Persecutory now and jealous type. We should probably mention the speculation of a process that begins to make sense of what we had just discussed. Nina um, might actually be jealous of others and through projection misattribute those feelings onto other people. That's a way, that is a defense mechanism for an individual to express what they feel, but in such a distorted way that it's socially acceptable. So her superego will not allow her to express those feelings. She's jealous of me, or excuse me, it's the opposite. I'm jealous of her. For whatever reason, that is not allowed to come to conscious awareness for this particular character. So through projection, that reattribution allows for the expression in a distorted way. She alleviates anxiety by being able to cathex that impulse, but in a distorted way that allows for the superego to filter it through what is referred to as the reality principle. Make sense? Okay. That type of not discussion, but that type of theoretical construct might be important if Nina were to engage in psychotherapy. Probably not something you're going to hear during an initial psychiatric evaluation. Other observations here?
I mean, just in general, I find that Nina's a very unreliable narrator throughout this entire movie, especially because of these hallucinations that she's experiencing. Especially the thing that I focused on, or I thought about a lot, was her relationship with this other ballerina. How much of it actually occurred versus did not? Because on one hand, she's saying, "Oh, we went clubbing, or like we went to the club, and then afterwards we went back to my apartment, and then the next day she meets with the same ballerina again." She says, "Oh no, we didn't meet at all or anything." So it's just being able to discern what is true and what is not true, and the who can we look to in the movie as actual fact, or who can we actually believe in this movie?
And do we have an answer? Yeah, yeah. Hopefully you were asking that question rhetorically,
Yeah.
because I'm not sure there is an answer here. I mean, what would have been interesting if, similar to other stories, A Turn of the Screw, The Legend of Sleepy Hollow, there was a narrator of the story, to kind of allow us to take a step back and perhaps lend some validity to the story. But you're right. Yeah, we're not really sure who to follow here. And I think that's clearly by design. She is someone who is struggling with reality. A large reason why she is struggling the way she is to determine what is real, what is not real, is because she is asked to evolve into the Black Swan. And her choreographer, her director, actually tells her that you are perfect. Um, you're restricting, he didn't say this, you are a restricting subtype of anorexia nervosa. You are perfect. Um, you're a perfectionist. You have obsessive compulsive personality traits. Everything that Toby had told you is true. That's actually in the script. You have to read it closely. What he tells her though is that you've convinced me. You've got the white swan. You've got to become that black swan. You've got to be more impulsive. You got to demonstrate more binge eating and purging types of behaviors. Um, and with that dichotomy and with that struggle, Nina begins to question what is reality and what is not. And we see this play out through the entire movie, including but not limited to this perceptual disturbances. All right, so a brief overview again of anorexia versus bulimia versus binge eating disorder. So the one thing that we have to remind ourselves is that uh, generally speaking, the eating disorders are misnomers. That is the way they usually come to clinical attention is through aberrant eating behavior, but they really have little to anything to do with eating, right? These are self-image disturbances. These are really self-image disorders. And anorexia nervosa is at the top of the list. So first and foremost, what you have to understand is that anorexia is defined through a fear of gaining weight despite being underweight. That is really the core sign of anorexia. That is not apparent in bulimia, right? Bulimia itself um, is actually defined through behaviors, period. And of course, those behaviors are binge eating and purging behaviors. That's not the case for anorexia. So first and foremost, subjective, objective. Subjectively, we have to ask our patients, is there a fear of gaining weight? Objectively, are they underweight? Because if the answer is yes to both, it's likely anorexia. If the answer is no to both, now you're talking about, or now you're focusing on bulimia. Bulimia is also a self-image disturbance, but it's a self-image disturbance resulting in this compensatory behavior that is defining of the illness, specifically the binge eating and purging episodes, right? 2 to 3 times a week over 2 to 3 weeks. Right? And then you have this third syndrome called binge eating disorder, which looks like bulimia, but the actual binge eating and purging is not a result of compensatory mechanism. That is, there's no self-image disturbance. It's behavior for the sake of behaving. But the behavior across the board, similar to anorexia and similar to bulimia, causes clinically significant distress or impairment. That's true across all 3 of these conditions. All right. So again, anorexia, a fear of gaining weight despite being underweight, which of course can manifest through binge eating and purging behavior. That is one of the subtypes. Bulimia, while it certainly shares that very same behavior and also is a self-image disturbance, has a form of compensation that is binge eating and purging that becomes defining of the illness. That is, the fear of gaining weight despite being underweight is absent. And then third and final, well, not really final, the third most common eating disorder, binge eating disorder, is just that. It's binge eating, but the binge eating itself has nothing to do with compensation for a distorted body image, because a distorted body image is not part of the definition of binge eating disorder. Any questions about the three most common eating disorders? Treatment. Treatment for any mental disorder will always be biopsychosocial. But there's a couple of comments to make here, I think, to tease away some of the things that are likely to come up in clinical practice and therefore likely to come up on a certifying board exam. So biopsychosocial, yes. Bio usually includes the prescribing of SSRIs with evidence of binge eating. So there is a place, there is efficacy within the SSRI class for binge eating disorder, bulimia nervosa, and the binge eating and purging subtype of anorexia. Right? So that's where the bio comes in. Psychosocial, primarily you're talking about a very specific form of CBT that's adapted to the eating disorder, right? But cognitive behavioral therapy is going to be at the very top of your list when it comes to psychosocial interventions for any of these three eating disorders, right? So just a little bit of specificity. The other two things, related topics, and we'll see if we can apply this to the film now, that often come up when anyone discusses the eating disorders, is when to hospitalize, because there's two general conditions we have to consider. Number one, when the patient is asymptomatic. Number two, when they are symptomatic. Well, the latter first, because it's easy. Any symptomatic eating disorder should result in inpatient psychiatric hospitalization. So if symptoms, hospitalize. That's both behavioral, suicidality, for example. It's actually captured in this film, and non-behavioral. Right? So symptoms that are due to electrolyte disturbances, for example. So if an individual has a seizure, you hospitalize. Not for the seizure, hospitalize for the seizure. But after hospitalizing for the seizure, management of the eating disorder should be at a level that is no less restrictive than an inpatient psychiatric facility, hopefully one with an eating disorder wing. Right? The trickier part is when the individual is asymptomatic. Right? So, and the general idea here with multiple examples is you should hospitalize an asymptomatic individual with eating disorder when there is evidence that outpatient care has been unsuccessful. That's the general idea. And I think there's like 5 or 6 examples that are published in the current treatment guidelines. But that's the general notion that I want you to learn today. Right? The other primary topic, or the other common topic that comes up on certifying exams, is called the refeeding syndrome. Right? So anybody here know what the refeeding syndrome is?
You see like their electrolyte levels go up way high when you're giving them more food if you do it too quickly.
Right. Right. And there's multiple signs and symptoms. It's a multi-organ manifestation, including the brain delirium, as well as seizures and other related cardiopulmonary, etc. Signs and symptoms. And it's usually due to the introduction of phosphate too quickly. So, hypophosphatemic metabolism, catabolic state. Prescribing the calories too quickly can result in basically a multi-organ failure, right? So it could be a medical emergency. Refeeding syndrome comes up on exams very frequently. Questions about eating disorders. So it looks like our main character is afflicted with anorexia nervosa, and it's probably binge eating and purging subtype, because it's probably both, which means the single best answer will be binge eating and purging subtype. Co-occurring illness for Nina.
I have a question. So, what would we do if, like, the cause of binge eating is from the environment, not the patient herself? For example, Nina is a ballerina. Maybe the whole environment around her says you should be skinny to be a ballerina. So what if we treat her, she went back to work and binge eating again?
And the unfortunate easy answer is that we would expect those behaviors to continue. And there is a significantly higher prevalence of eating disorder, specifically anorexia, in vocations that require thinness. That includes acting, that includes dancing, including um, Nina's being a ballerina. There's no doubt about it. As a psychiatrist, you certainly will discuss this with a patient, but there's no way any psychiatrist would ever recommend quit your job, nor should they. Right? So the risks and benefits of continuing to do what you're doing should always be presented, and the individual with their autonomy needs to provide the informed consent. They need to make their autonomous decision. But part of that discussion is if you go back to that environment, that includes the home environment too, with this interpersonal relationship you have with mom, these behaviors are likely to endure. And the sequelae for these behaviors, as evidenced by your presenting through our emergency department yesterday with a seizure, are likely to reoccur. So full informed consent so your patient can actually make an informed decision. Other thoughts about Nina? First, nobody's brought up dissociative identity disorder.
Yeah, I kind of think that she has prominent mood symptoms also.
Yeah.
Like, I actually think that bipolar disorder with psychotic features should be explored. I also think that it's like a metaphor for the movie, like the White Swan and Black Swan. Because in the Black Swan, she seems like she has kind of like grandiosity. I don't know if she's not sleeping, but she's up at night a lot. And it's for like a sustained period of time, at least a few days. I remember she kisses the director like off stage, like she has like grandiosity. She's impulsive. Um, so I think that should be considered.
Yeah, I agree. I mean, I would even go so far, more than considered. I think it would, I don't want to say it would never happen where a psychiatrist would not do it, but it would be highly unlikely that a board certified psychiatrist would think not to evaluate for bipolar here, including the atypical onset of her illness, meaning that she's a little young to have a first episode of depression. Now, can she actually be depressed at about 23 years of age? Absolutely. But we also understand that there is a likelihood that an individual that age presenting with a altered mood state might actually be presenting with a depressed episode of bipolar disorder. It's something that has to be very high in your differential here. Right now, line of questioning, psychiatric assessment, of course, would be dig fast. Have you ever experienced this constellation of symptoms at all? If the answer is no, the inevitable question you're going to get back, Nina and or her mother, is, but doc, does that mean she might have a manic episode in the future? And the answer is, we don't know. There's no way of predicting. Now, of course, the likelihood would increase if there's any family history of bipolar, but beyond that, I mean, we have to review the signs and symptoms of mania, dig fast, and make sure that the patient and or family knows to call the office with any concern that those signs and symptoms are manifesting, because her depressed episode might actually be the way in which her bipolar illness is presenting. Most people will present with a depressed episode first. And at that age, that's something to consider.
Yeah, I would say that's probably my highest on my differential for her. I definitely think there's a dependent personality aspect also with the relationship with mom. I mean, mom has a whole host of problems herself, but I think that should also be considered. But we obviously first need to rule out any kind of substance or medical stuff. So you can say that this is like a substance-induced mood disorder, maybe, but I think that the state that she's grandiose as the Black Swan is a little bit more that can be explained by a one night of
Yeah,
ecstasy and
great.
intoxication.
Yeah.
But that's something to consider from an academic standpoint.
Right. Yep. And again, we would inquire, we don't know if she's used drugs prior to, but I think the way this movie is presented, the intent is to show us a very naive ballerina who has never experimented with drugs prior to her experimenting with ecstasy.
And also to support that, I remember she got offered a glass of champagne or something with the director, and she said like that she doesn't drink or like one glass or
Mhm.
something.
Mhm.
So that's further support she probably hasn't used any substances.
I agree. Yeah. And since we're talking about it, she's young enough where even though we would still recommend her returning to her primary care, all that which we're observing is not likely to be due to an underlying medical condition either. Right, very unlikely. All right, any other characters you want to take a look at other than Nina?
I guess her mom is like a really big factor in her development. So like specifically just not letting her lock her door like however long. And then she's 25, like there's at least a little bit of privacy.
Mhm.
And all of the other behaviors, like obsession over like her daughter, she had the whole room of drawings and paintings.
Mhm.
Probably excluded.
Yeah, in psychology, that might often be referred to as an enmeshed mother-daughter or mother-child relationship here. And certainly that is consistent with what we have identified as the etiology of anorexia nervosa, right? The over-enmeshed parent, the intrusive parent, resulting in personality variables that are often, again, characteristically comorbid with eating disorders in general and anorexia in particular. The opposite dynamic is usually seen in bulimia, where it's more of a rejecting parent and there's emotional distance. So this is much more consistent with anorexia nervosa. Anything else? So one other character that I think we need to just briefly touch on.
Maybe the director.
Yeah, I mean there's a designation in the DSM for him, but he wasn't who I was thinking of.
The other retired ballerina.
Nope,
Lily.
no. I mean, Beth, there's a lot. Yeah, I'm not saying no. I didn't miss anything, guys. All right. It's actually, and this is usually a primary focus of groups like this. I think a person who watches this movie in a theater wouldn't think anything of this, but we're here to analyze. We're here to kind of delve into some things that I think the general public would leave well enough alone, and that's Lily's father, right? So there's a reason why he's not in the script. Again, now for the normal moviegoer, yeah, the reason is that the director decided not to write in the father, right? No, it's not right. In medicine, this is called a pertinent negative, right? So where's that? I mean, because there's a 100% likelihood that it's a question that any psychiatrist will ask Lily during a psychiatric evaluation. So where is that? And why?
He probably left them because the mother pushed him away.
Maybe,
That's probably what happened.
maybe. Any other thoughts?
Or her father doesn't know he has a child. Because I see that like her mother said she sacrificed her career for having this baby.
Mm-hmm. Just to play counterpoint, I can envision a boyfriend, assuming they weren't married yet. I can envision a boyfriend upon that decision being made, actually saying, and I'm with you by your side in your decision. I support you in this. If you're giving up your career, I have a role here. I would hope that the opposite isn't true. Like, oh, you're making a decision and bye. So again, as a psychiatrist, we're going to ask, what are some other possibilities in terms of answers we may get?
Maybe passed away.
Yeah, he might be deceased for all we know. Other?
Or he might have been divorced. Like maybe he's down the street on maybe.
What a twist that would be.
Yeah.
He's the actual director.
Yeah.
Oh my God.
Yeah.
Well, that will be.
So I think mom did push him away, but I don't necessarily think it's for reasons that appear obvious. If there was some kind of transgression in that house that mom discovered and therefore knew of, she may have kicked him out. And if that is the case, early childhood trauma, we actually now have another etiology that we have to consider. Certainly a focus of psychotherapy for someone who is looking to get help for anorexia nervosa. And especially if we see aspects of this movie, certain scenes that appear that, I almost said Lily, that Nina is struggling with DID or dissociative identity disorder, which again, in its etiology, would likely include severe sexual trauma. So it's something to consider. And with DID being a possibility, and therefore sexual trauma being a possibility, we have to look through that lens when we ask, where is dad? And I don't think an answer of, well, no, it's okay because the writer-director just decided to not include him. There's just no way that we would find that acceptable. Pertinent negative. Which then explains the reaction she has to her director doing what he does, which is probably something she's seen before, experienced before. Any final thoughts? Black Swan. So in closing, and I wish I had the date, I probably could look this up. I want to say at or around 2012, a second-year medical student who was the representative for the psychiatry interest group, now called Praxis, came to me and asked if she could host a movie that I could help facilitate a discussion about to certainly conjure interest, to foster interest among second-year and first-year medical students that were interested in behavioral health. At the time, she picked Black Swan, and it was from that actual event that we created Fiddler. That was our first Fiddler movie, even though we didn't know what Fiddler was back then. Fiddler now is a monthly movie club for third and fourth year medical students, longitudinal credit, where in the East Lecture Hall on a monthly basis, we now watch a selected film and have this type of discussion, albeit over Twitter, during the movie. But Black Swan was our first, even though we didn't know it back then. So we'll close with that.